Getting used to your braces. As we work on perfecting your smile, it is normal to experience some slight discomfort. This tends to occur when your teeth are moving. We recommend taking ibuprofen or acetaminophen to manage any discomfort. This typically lasts a couple of days, and it can be expected after the braces have been placed and after each wire change. Eating cold foods, such as frozen yogurt or popsicles, can temporarily freeze the teeth and alleviate unease. We also recommend eating soft meals. Some soft food ideas include soup, rice, mashed potatoes, yogurt, scrambled eggs, oatmeal, smoothies, and pasta. These foods work really well in the first 2 to 3 days to help make it easier for chewing. Your orthodontic appliances can also rub and irritate the insides of your cheeks and lips. Your cheeks and lips will adjust to this constant friction and form tougher skin, but in the meantime, it can be uncomfortable. Here are a few tips you can try. First, you can try applying orthodontic wax to the area. This is used to cover any bothersome brackets or poking wires, leaving a smooth, comfortable finish for your cheeks. Warm saltwater rinses help to heal any irritation or canker sores. You can mix a teaspoon of sea salt with 1 cup of warm water. Rinse with this for 2 minutes twice a day. Colgate Peroxyl mouthwash is a minty flavored mouth sore rinse. This is an over-the-counter hydrogen peroxide mouth rinse that is specifically designed to help cleanse and promote the natural healing of minor mouth irritations. Now let's talk about foods to avoid. There are 2 major categories of foods to avoid: hard foods and sticky foods. Let's talk first about sticky foods. These foods are typically very high in sugar and they get caught all around the braces and the teeth. This increases your risk for cavities. They can also cause brackets to break off of your tooth. Some examples of these foods are gummy bears, fruit roll-ups, gum, Starburst, caramel, fruit to-go bars, and jerky. Hard foods can be way too crunchy and apply pressure to the wires and brackets, which can cause your braces to easily break. We tend to avoid them altogether, but some of them can be eaten if you modify the food. Here are some examples. Popcorn. We do not recommend eating any popcorn. As an alternative, you can try eating Popcorners brand of chips. Whole nuts and seeds, such as almonds, peanuts, and cashews. These can only be eaten if they are chopped into very, very thin slivers. Hard chips, such as corn chips and kettle chips. We avoid these ones altogether. Try eating a softer potato chip like a Lay's type of chip. Hard crackers like Triscuits. Try eating softer ones like Ritz crackers or Goldfish crackers. Ice cubes are very, very hard and crunchy, so we will stay away from those completely. Crunchy fruits and veggies, like apples and carrots, need to be cut up in small pieces. Veggies can also be cooked so that they are soft. Fruits that have a pit in the center, such as cherries and peaches. Please cut the fruit off of the pit to eat these and do not bite directly into the fruit.
Granola bars typically have clusters of nuts or chewy chocolate drizzle on top, so it's best to avoid these. An alternative would be Nutri-Grain bars, since they are much softer.
Meat that has a bone in the center, like chicken wings and ribs. Please do not bite directly into the meat and cut the meat off with a fork and knife. Crunchy breads, such as bagels, baguettes, and pizza, should be cut up in small pieces, and we should never bite directly into these foods. The action of biting and ripping and tearing with your teeth can add a lot of additional pressure to the braces and wires, and it can cause things to break. Hard candies, such as Gobstoppers, Nerds, Jolly Ranchers, mints, and lollipops, should be completely avoided. That being said, there are some sweets that are considered safe to eat. These foods will not break your braces, but they are quite high in sugar, and therefore we do not want to make these everyday foods, more like once in a while treats. I recommend pairing these treats with a meal and avoiding snacking on them for long periods of time. This reduces the duration of sugar and acid attacks on the teeth. Some examples of soft treats are soft cake and cookies, soft chocolate like an Aero bar or plain milk chocolate, and ice cream. Now keep in mind that with the braces on, you are far more susceptible to developing cavities. There are all sorts of new spots for bacteria to hide in areas that are tricky to clean. Therefore, after every single time that you eat something sweet, we do recommend that you brush your teeth. Next, we'll talk about how to clean around your braces. Now that you have braces on, we encourage you to brush your teeth 3 times per day. Once in the morning, once after lunch, and once more before bed. Keeping your teeth and braces clean is very important for your orthodontic treatment. Not to mention that getting food caught in your braces can be very unappealing. For brushing, we recommend trying an ultra soft toothbrush. We'll brush the teeth on the 3 different surfaces of the brackets. Covering 2 to 3 teeth at a time, we brush back and forth 10 times on each surface. We brush beneath the bracket, directly on the bracket, and at a 45-degree angle above the brackets along the gum line. This area along the gum line is where most patients miss, and yet it is the most important. We apply gentle pressure to the gum line without scrubbing hard. If using an electric toothbrush, adapt your brush in the same 3 positions and gently move the brush along the teeth while allowing the brush to do the work for you. Proxa brush. We recommend using this brush beneath the wire and between the brackets once daily with toothpaste on it to reach all the spots that your toothbrush can miss. Direct the wire tip of this brush under your wire, always away from the gums. You can bend the tip of it to make it easier. This tool is also very helpful for dislodging any trapped food beneath your wire while you are out. If for some reason you do not have a chance to brush your teeth after you eat, always rinse your mouth with water and then check in a mirror, and using your Proxa brush, you can remove any large pieces of food debris. Then brush as soon as you get a chance. We recommend replacing this brush as often as your toothbrush, so once every 3 months or sooner if you've had a cold. Flossing should be done daily with braces. Using the blue threader, we insert a long piece of floss through and fold it over halfway. Direct the tip of the threader beneath the wire, pointing it opposite to the gum line. Bring the floss between the teeth and glide it up and down on each side of the gum. You can also use it to floss around the braces and the wire. Repeat this step all the way to the back teeth as well. A water pick is an excellent tool, and we strongly recommend using this because it can make flossing so much easier with the braces. It can actually replace daily flossing. While using a water pick, we aim the water stream directly at the tooth, just along the gum line, and this will flush out the bacteria from below the gums. Taking care of the teeth and braces is crucial in keeping the teeth moving and keeping your mouth healthy. We will check your oral hygiene at each appointment and review with you as necessary. The risk of not caring for your teeth during orthodontic treatment are cavities, swollen gums, and decalcification, which leaves marks on the teeth forever. Next, we'll talk about what is in your mouth and what to expect. Now let's break it down and show you what is in your mouth. The silver squares that are glued onto your teeth are the brackets. If ever a bracket became loose and is moving back and forth on the wire, please contact us. So long as you are not in pain, these can usually wait a day or 2 before being repaired. If this occurs within a few days of an upcoming appointment, please contact us for a heads up, as we would need to add additional time to your current appointment in order to fix it. Wires. The wires are what connect the braces together. The first few wires are very thin and flexible, and they will gradually increase in thickness over time. If a wire ever starts to poke you at the back, you can use some wax temporarily to coat the area. This should help with comfort. This typically happens as the teeth are moving and the wire can start to become longer than it needs to be. Please give our office a call and we will get you in to fix this as soon as possible.
You might be wondering about those little colored ties you sometimes see on people with braces. This depends on what kind of bracket system you've chosen. The first type of system is called American or twin brackets. These little elastic ties hold the wire to the brackets, since these brackets don't have little doors that open and close to hold the wire in place. Each time you come, you'll be able to change these colors. The next type of braces are called Empower Metal or clear braces. In this case, the elastics are just for fun, since these brackets have little doors that open and close to hold the wire in place. Typically, these colors go on the front 6 teeth, so they're more visible. Generally, these small colored elastic ties don't fall off your braces. However, if you do have American braces and one of your colors falls off, please call the office so we can get you in as soon as possible to ensure that your wire is still secure. Depending on your bite, we might use some different tools to help stop you from biting your braces off. The first tool we might use are called bite pads. Most of the time we use these if your bite is very deep, which means when your top teeth cover 50 to 100% of your bottom teeth. These bite pads are small dots of blue glue that are normally placed on the biting surface of your molars. As your treatment progresses, they will be reduced. The second option to help with your deep bite is called a bite turbo. This can also help with anyone with an underbite, meaning when they bite down, their lower teeth cover their top teeth. When placing bite turbos for a deep bite, they will go on the inside of your top 2 front teeth. For an underbite, they go on the inside of your bottom 2 front teeth. The third option to help with deep bite are called bite bumpers. Bite bumpers are similar to elastic ties. They're small, sponge-like, and gray and will usually fit right around the bracket. When you're biting, you'll notice that it feels like you're chewing on something soft. These also help prop the bite open, but are mostly used in minor cases where only a couple teeth are at risk for biting braces off. Just like the elastic ties, they are changed at each appointment, but if they do fall off, please give the office a call. Starting now, your job is to keep your teeth and braces clean to make sure you have the best result at the end of your treatment. If you have any questions, please let one of your hygienists or assistants know. You can always email or phone us as well. Congratulations on starting the journey to your new smile.